Hello everyone. Let's dig into what these tools are that I keep talking about. So, if you've listened to the other videos, you know that I am an intimacy behavioral therapist and I help people access ease from within their bodies when giving and receiving touch. And this enables them to eventually overcome a whole host of sexual problems and develop within themselves the ability to call forth these tools and use them in real time to be able to replace the anxious response that they feel with more ease. So that said, what are these tools? So when I'm working with someone and I'm doing the physical part of the therapy, and also I want to just clarify, so this is a form of sex therapy that I offer, talk and touch. So when we get to the touch part, I'm sitting on the floor on a exercise mat with a sheet on it, and we're sitting face to face, myself and the patient. And I'm teaching them, so when I'm, the first physical session, I should say, part of the session, is where we're exploring these tools. And what we're doing is in exploring them, we're discovering how their bodies are responding. So I have to preface this by saying that I've learned over the years that our bodies shift, change, trust, open, learn, all these things very slowly, gradually, very different process than from the mind. So that means that it takes patience and repetition. So back to the tools. The first tool is breath. So why? Well, obvious, right? It's the secret to life. Breathing. Most people are only breathing shallowly unless they're doing it for a living, like they are they're using it as a tool for their work, as like an opera singer or an athlete or an actor. Most people, though, are breathing shallowly only into their lungs. And very little air is moving down into the diaphragm, which is a group of muscles basically just below the breastbone in the center of the, just below the chest down. And they expand when you breathe into them so that you're able to double, triple the amount of air and oxygen you're getting every time you breathe. Why is this important? Because when you're able to access more breath and you practice it, your body starts to do it naturally, which means you're getting more oxygen and you're potentially loosening the grip of the mind, and you're enabling your body to relax and open as much as possible, and also enable you to be more in the present moment. So this process also is a form of mindfulness in action, actually doing it, constantly returning. We use the breath as a tool to continuously return back to the body. Return from where? Out of the mind. Noticing I went up in my head, I was focusing, I need to come back down. That's what one of the uses of the breath. So we explore what it is. I show them, I teach a process of how to access this deeper breath. I use visualizations. There's a whole process to that. Won't go into all of that now. However, in sitting face to face, I'm teaching it so that the person right there with me can begin to engage, practice it, see what it feels like in their bodies, deepen it, find out, is taking in the air more fluid, letting it go, where the blockage is, really just experimenting with how their body just naturally takes to this. And then I give them the homework, of practicing it so that it becomes muscle memory, becomes cellular memory, becomes something they can draw upon, which only happens through practice, right? Human bodies have to practice something that's physical for it to take as something that becomes natural without thinking. So I give them some of that as homework. And then that opens the way to the second tool, which is sensation focus. So what is that? That is literally teaching a person to focus on what they're feeling, physically feeling in the moment when they're giving and receiving touch. So I mentioned earlier, we work with the hand and the arm, the hand and the arm to focus in on, and I ask them to close their eyes and describe what they're actually feeling when they're touching. Is it hard? Is it soft? Is it smooth? Verbalize, so that the verbalizing enables you to identify what you're feeling and keep you focused on it. none of these are perfect. Of course, sometimes people get stuck with verbalizing or trying to come up with the right words, and that's a whole thing. However, if you don't verbalize, what happens is your mind just takes you somewhere else. So we need to stay really right with what we're feeling, what we're experiencing, moment to moment to moment when touching. And the way that I go about this is, I mentioned eyes closed. Yes. So science supports, right, when the eyes are closed or when any sense is not being used, one of our senses, it enables the other senses to become enhanced. And we want that. We want to be able to, also it's obvious you're not, get distracted. However, it really helps you to go in and stay within your own experience, within your body. So that's essential. And I also ask that my patients go first. And the reason I do that in any touch exercise, I describe it, but then I ask them to initiate it. And the reason is so that they don't mimic me. Frankly, they're not just trying to be a good student and a good mimic and figure out this is what she wants me to do. There's no right or wrong way to do these exercises. It's a discovery of how your body, just naturally responds and reacts to doing it. That's what we're looking at. So it's really sensation focus, little history. So that exercise comes from Virginia Johnson of the Masters and Johnson's duo. Masters was a doctor. They were both considered like sex therapists, sex doctors back in the 50s, 60s, 70s. And they were revolutionary. You may have seen Masters of Sex, which was I think a Showtime special a few years ago. Of course, very glamorized, but gives you an idea. Anyway, one of the genius things that they came up with was this kind of exercise of sensation focus. So we use these two tools throughout the entire process. And in another video, or maybe more than one video, I'll share more about the sessions and what they can look like and why it's not uniform, right? It's really tailored to each person and what's happening with their body as we're discovering in the early sessions. So that's a little bit of a background, if you will, or explanation of these two tools and how or why I'm using them. Again, I'll go more into that in future videos. So thank you for listening once again.